everybody, and to say that I'm sorry, but something happened to my internet, even though I did all the measures that this doesn't happen, but it still happens. So that's what happens. Okay, I'm trying to make my screen look better. Okay. So I would like to tell you something about One Health education. I'm not sure how much you know because I don't know you, but probably you will not hear anything much new. If you're a good internet searcher, then maybe you will not hear anything new. But I hope I will tell you something from a different perspective. So hopefully you'll get something from this presentation. So we're talking about One Health education. Where do we stand and where should we go? That's a pretty pompatic title, but let's see how we can address that. Before we go to the subject itself, I want to give special thanks to Maria, Sean, and Barbara, who got me involved into all of this. And I hope we continue to collaborate even though this presentation ends today. So who am I and why did people invite me today? I work at Scientific Veterinary Institute, Novi Sad in Serbia, and I'm head of department for serology, immunology, and biochemistry. Basically, that's the lab for zoonotic diseases. It's a diagnostic lab within the institute. I'm head of National Reference Laboratory for Q fever, Medivisna, and leptospirosis. I'm also quality manager of our institute. And then I'm board member of EcoHealth International. I'm vice chair of Network for EcoHealth and One Health. I'm one of the 3 founders of Serbian Association for One Health, and I'm the organizer of One Health Day in my country. My expertise is, besides One Health, public health and vector-borne diseases and animal infectious diseases. Actually, I started working with zoonotic diseases and then I switched to vector-borne diseases before this One Health enthusiasm came over me. I'm from Serbia. I expected that most of people today are from Europe, but then I learned that there are some of you that are not from Europe. So I give here a small tiny map. That's actually a map of Balkans and the surrounding part of Europe. So you can see where Serbia is. It's in the middle of, let's say, Balkans. So it's a country from Europe. And it's known for our sports activities. So our sportsmen are very famous. You see the tennis player with the prize in his hand. Maybe you recognize him from TV. We are known as happy people. We're known for good food, very dramatic history, as the whole Balkans also. And we're also known for some international music festivals. One of them is Exit Festival, and probably some of you even went there. My institute, Scientific Veterinary Institute, has been founded in 1950, and we have just celebrated 70 years of our existence. So that's a long time and long tradition. And we are also, we're working as a government service, as a diagnostic lab. We're also a national reference laboratory, and our main task is to monitor and preserve animal health and to monitor and contain zoonotic diseases. No matter if, no matter if they started with humans or animals. And our institute was the first scientific institution with international standard certificates for quality management, which is also important in the matter of organization of our work. Now, let's go to One Health. I wanted to ask, I can't see all of the people. I don't know how I can see that. Okay, I wanted to ask if how many of you are involved in One Health activities at this moment. But if you raise your hand, I can't see. So maybe you can put it in the chat and then I will see it later. Because some of you are maybe just learning in school or college, faculty, whatever. And some of you are already working. So my interest was, how many of you are actually involved into One Health activities. Sean, will we be able to see this chat later?
Oh, yes, yes. And I can save the chat and send it to you as well. So if what everyone can do is if you put in your chat box what organization you're with, and then Dr. Sara can see it after as well and engage with all of you.
Okay. I would be more happy to see it while we're talking, but okay, this is the price.
Can you see it while you're presenting? I'm not sure because maybe you're sharing your screen, so it's hard for you to see the chat while you're doing it.
Never
the
mind.
downside of you sharing the screen.
Yeah, I can't find it at the moment, and then I don't want to ruin something. Maybe I don't know. Okay, I opened the chat, but then you can also see it, right?
No, no, it would just be on your screen.
Okay.
So we can still see the slides.
Okay, perfect. Okay, good. So some people are replying yes, yes, yes. Okay, good, good. Then you have to understand something. I have been in my faculty 25 years ago, and at that time, the phrase One Health did not exist. So we just had zoonotic diseases, and we had human medicine and animal medicine, and that was it. But for you who are now at faculty at any stage, One Health is somehow known fact for some of you, for some not. So you have to know that when I was in school, we didn't know what One Health was. It didn't exist because I was at college in the 90s. Okay, some history. At 2007, American Veterinary Medical Association was established. One Health Initiative Task Force was maintained to study the feasibility of a campaign to facilitate collaboration and cooperation among health science professions, academic institutions, governmental agencies, and industries to help with the assessment, treatment, and prevention of cross-species disease transmission and mutually prevent non-transmitted human and animal diseases and medical conditions. So these are quite heavy words in a small piece. But when you look slowly into them, that's really what One Health does today also. So it was actually the first disease that came was the avian influenza in 2006. And that's kind of like the trigger when it all started. So they figured out that there has to be some collaboration, some transdisciplinarity, and some multidisciplinary assignments. One Health is defined by One Health Initiative Task Force as the collaborative effort of multiple disciplines working locally, nationally, or globally to attain optimal health for people, animals, and our environment. So this is the first time that people mention humans, animals, and environment in the same context. Because even before, maybe when some diseases are in question, like, I don't know, brucellosis or rabies, people got the idea of humans and animals that had to be examined at the same time. But this is the time where environment comes in. Okay. Today, we have many organizations that deal with One Health. So One Health is defined as collaborative, multi-sectoral, and transdisciplinary approach by most of them. We have One Health Initiative, Center for Disease Control and Prevention, WHO, World Health Organization, EcoHealth International, One Health Commission, the OIE, which is the International Organization for Animal Health. And they're all working at local, regional, national, and global levels. So they are all international, but they all have some kind of regional levels within. And they want to achieve optimal health, recognizing the interconnection between people, animal, plants, and their environment. So we insist on these underlined words, which are collaboration, multisectoral, local, regional, national, global, and environment. I'm happy to see that, sorry, I'm just reading your chat. I'm so happy to see that there are also people from Africa and other continents, and this is so cool. I really thank you for organizing this. This is so nice. I like this very much. Okay, let's go forward. Now, okay. Why do we want to learn about One Health? I would like you to put in chat now if you are member of some postgraduate One Health course. So if you are, just say that you are, and then we'll see how many of you are. And I'm pretty interested in why you chose this course or postgraduate topic or whatever, because it is popular in some kind of way, especially now in COVID situation. But on the other hand, it's not too much known all over the world. So I'm very much interested, why did you choose this and what did you choose? Many of the same microbes infect animals and humans, and you already know that, and they share the ecosystem they live in. Efforts by just one sector cannot prevent or eliminate the problem. Now, COVID is a perfect example of this, because you needed so many people in order to get even to the fact what happened to us in January last year. And they figured it, but much before. So now with COVID, we are already somehow, hopefully, already in the game with One Health. Okay, so we have antimicrobial resistance, global health. Okay, I'm reading, I'm a student of infectious diseases. Good. Infectious diseases and zoonotic diseases are mostly the most example for One Health. And people usually, when you say One Health, people usually think about zoonotic and infectious diseases. That is true. And there are so many other things, but let's stick to that for the beginning. So rabies in humans is effectively prevented only by targeting animal sources of the virus, by vaccination of dogs, by having the baits for foxes, and so on. So people understood that by getting to rabies from in dogs and foxes, they will help humans. Also, brucellosis in humans is only resolved by eradication in animals. We had a paper where we looked at the control of brucellosis in 2 different countries. In one country, it was resolved by the veterinary sector working on animals, and in other country, it was resolved only by human sector working basically in humans, because they had so many more human cases. Of course, they could not resolve the human brucellosis until they resolved the disease in animals. So that was the bottom line. Okay, leptospirosis in horses. Please give me, at the end, give me your contact. I would like to contact you later on. But then we have drug-resistant microbes that is also been so much popular during the last years. And it can be transmitted between animals and humans through direct contact between animals and humans, or through contaminated food. So to effectively contain it, a well-coordinated approach in human and animals is required, but also it requires the control of food. Now it's very popular in several countries to have monitoring of food for AMR, but also monitoring of animals, farm animals, even pets, for the same reason. Leptospirosis is again a zoonotic disease that can be maybe in this beautiful pond in the picture, you don't know because you can't see it, but it can also affect animals and humans as well. So why do we learn about One Health? Because we want to tackle the problem of a disease or whatever from different ends in order to have a more comprehensive research. If you have all the facts in line, then you will much better do your research and much better understand the disease. You can do the better presentation in the media. Can you imagine if one disease, let's say leptospirosis, if you have it presented in the media just because it's leptospirosis in horses, but then if you add that it can affect people, how much more media it gets? So that is a very important issue, especially when you try to promote One Health. So the pressure on the government or international stakeholders when you want to get project or money or whatever is also much, much better when you have the One Health approach, having all the three pillars in game. Research collaboration is also important, and that's one of the main challenges with researchers who are not used to communicating with other branches of science. And for us who are already in our 50s and had no One Health experience before 2000, that was quite a nice challenge. And of course, it's cost saving. One Health approach is definitely cost saving compared to having three different researchers on the same topic. Where can we learn about One Health? I'm sure that during this year, I mean, you're young people and you have already so good internet skills. But during this COVID situation, I'm sure that all your internet skills have improved very much. And so you're learning wherever you turn to internet, you can learn something. But let's say the official ways of learning about One Health can be the usual one, ex cathedra way, or many or any other way. So at the university, you can have graduate, postgraduate studies, courses, and topics within a course. But you can also learn from congresses, conferences, meetings, projects, webinars, courses, and summer schools, working groups, associations, journals, and books. We will go through all of this very shortly, but also this today is also learning. It's a meeting of ISOHA. So somebody, an organization, association, whatever, organizes some kind of meeting, and that is also education. Education today is not only what you learn from your official teachers. It is whatever you can gather from any of these devices. Okay, this is from ISOHA website. I went today to search and see what we have there. And so I saw that you have a beautiful map of all the events going on. And so you can see here they have by different colors, they have colored the university program, PhD, master's program, postdocs, meetings, associations, and so on. But what I wanted to show here, of course, we will not go through all of this. You can do that by yourself on the ISOHA site. But what is very interesting for me, that's the quantity of happenings in the world. So you can see the states. The states are overwhelmed with everything. You see how many stuff is going there. And you can see the Western Europe, so UK, France, Norway, Sweden, and so on. And then we go to the last purple sign in Europe, then comes the Balkans, and then Russia, Asia, and so on. So you can see how unevenly it is divided. Also in Africa, only in several places you can see something going on, and then in all the rest of the world, nothing. So I'm not saying nothing is going on, so nothing has been registered. There could be some local things going on, of course, that you cannot get everything. But this is a very nice example, and this is the actual situation in the world. A lot of that is going in the States. Some of it is going on in Western Europe, and very, very few things are going on in the rest of the world. Now we go on closely to Europe. Now, when you look in Europe, so you can see stuff going on in the Western Europe. And sorry, I have to remove the chat because I can't see my screen. And you see the sign that is near Serbia, that's actually Bosnia. In Bosnia was a master course organized through Erasmus program. I don't know if anyone here is from Bosnia, maybe you can help me, but that worked several years ago. I'm not sure if that program is still going on, but that is the only thing that was going on in the Balkans, as far as I know, and as far as this map knows. So it should be right. Yes, 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 put the website on. It's very nice, and you should go all and search this website. So we will see later on what is science represent, but I just wanted to tell you that not much education is shared in Europe compared to, let's say, the States. There are things going on. We can't say nothing is going on, no, but very few things are going on in very few countries. That's my point. Okay, let's go to the very official education to universities. So, University of Glasgow, Edinburgh, London School of Hygiene and Tropical Medicine, University of Barcelona in Spain, University of Utrecht in Netherlands, are offering, in Europe, are offering official education in One Health. Then there is University of Alaska, Ross University, which are overseas. University of Glasgow is offering master studies in One Health, which is online. That's what I saw on website. So maybe it's just because of this situation. Maybe usually they have a normal course, but now it says online. University of Edinburgh also offers master course in One Health. Royal Veterinary College offers a module in One Health in bioscience, and PhD on One Health topics. You cannot be a doctor of One Health. So that's not the title. You get a PhD on One Health topic. And then there's London School of Hygiene, which with Royal Veterinary College also has master course in One Health. It's a joint course. So that's what I found in UK. Maybe you guys know more, but this is what I found in UK, and that's the country that has the most to offer. Then there is University of Barcelona. I don't want to pronounce this in Spanish, but maybe you know Spanish. And they offer master degrees in zoonotic diseases and One Health. And also in Netherlands, the Utrecht University, they also have the master's course in biomedical science. So you can see the most of them has master courses, and only few have PhD with One Health topics. If we go overseas, of course, there is much more going on. So University of Alaska has a center for One Health research. So that's probably as much as education, but more research facility. Then University of Washington offers Center for One Health Research. Ross University offers master course in One Health and certificate in One Health, which is online. Collaborative specialization in One Health at University of Guelph in Canada, and so many others. But undergraduate programs are all in the United States. So correct me here in chat if I'm wrong. Are there any undergraduate programs going on in Europe? If you know of them, please tell me, because all I could find was in the States. Now, the next way that you can educate yourself and learn are the projects. We've had a project going on from 2014 to 2018, which is called Network for Evaluation of One Health. And we have gathered quite a bunch of people, I think almost 200. And Barbara will tomorrow tell you more about that. But that was all about the topic of One Health. It was the main topic was evaluation of One Health, and I will tell you about that a bit later. But that was a very interesting project and very early in the time, so that we were like kind of like the first ones going on with this. And then there are projects that do not content One Health in the title, but the topics are in that line. So you can probably go into a project and then find out that it's about One Health. It doesn't have to have One Health in the name. In Belgium, master, okay. Courses and summers, oops, sorry. Okay, webinars, I didn't want to list them here because there are so many, especially this year. There were like, I don't know, 100 webinars on COVID. And let's say 90% of them are from the One Health perspective. So this year was really overwhelmed with webinars, due to the situation, due to the topic. If this disease was something else, then maybe it wouldn't be so interesting from a One Health perspective. But anyway, we had some kind, if I may say that we were lucky, then okay, let's call it like that, that this disease was One Health interesting. And so a lot of webinars came out this year. Also, you can find some free webinars in all of these associations and organizations that I have listed at the beginning. All of them have some kind of educational material. So it's maybe not a webinar, live webinar going on. It could be a recorded one or something like that, but you can also find that kind of material all over the internet. Very available and free. Now, courses in summer schools are, for me personally, very interesting because they last short and you get instant knowledge in a small pack, nicely packed. And EcoHealthNet Research Exchange Summer Internship is organized by EcoHealth Alliance. Now, these summer schools and courses probably cost some money. I don't know if they're free or not, but I think most of them are not free, but are very interesting material to gather in a short amount of time. So that's their advantage. One Health International summer course at the University of Copenhagen and Technical University of Denmark, that goes on every year. I don't know if it went this summer because of the situation, but the previous summers it was going on. And it's also a very interesting summer course. It's in English, and I know that it gathers a lot of attention and students. And then there is online course, One Health Connecting Humans, Animals, and the Environment for University of Basel. So this is what I could find in Europe. And there are probably a lot much going on, especially in the States, but you can search all of that by yourself also. Working groups. Working groups, they're usually hidden. So usually you have to be a member of a project or association or a center, and in order to get to that working group. You cannot type into Google working group of One Health for One Health and then get a number of working groups that you can join or somehow contact or something. You have to go into the institution and then find a working group. Within the network of EcoHealth and One Health, there are different working groups. Now, Network for EcoHealth and One Health is a European chapter of EcoHealth International. And so we are like, we became from that cost action that I told you a few minutes ago, the Network for Evaluation of One Health. So after the cost action finished, we became part of EcoHealth International, all of us together. And that's how most of your speakers for this week know each other. And you will see when we finish all of these presentations, you will see that we're all connected. And then we all know each other. And I think apart from one speaker, all of us come from this group. So that's also very interesting that within these working groups, you meet people and then you find out that we're all kind of a closed circle, and that circle is getting bigger over the years, but we can all follow each other and follow each other's work, and that is so convenient when you know each other, and then you can also collaborate or ask for help or anything like that. So that's why I like working groups, and that's why we're stuck with this slide for a long time, because I would really like to promote this, especially for you people who are already working, who are not at the faculty anymore, and you can enter this, especially if you're in some kind of scientific or university institution, you can enter these groups within the projects or within the associations, and then gather very much from that work. So within our network, we have like a group for transdisciplinary, a group for learning, a group for gender issues, a group for education. Yesterday, you had a presentation on gender issues from Julie. She's also our member. And then on Monday, you had Simon, I think, if I'm not mistaken. He's also from the learning working group. And so all of their experience comes from a joint work within those working groups. working groups are, as I said, less visible, and you have to really search for them. Now, associations are something that is always promoted. All of the associations have in their task to gather members. So it doesn't matter if it's free or membership free or you pay for membership, but all of them want to involve people. Now, you have to choose where to get involved. But when you do, you will be attracted to different working groups and different smaller groups even, in order to write a paper, to do a research, to collaborate in some way. It's mostly interesting if it's international, because we know so, I think we in Europe know so little about Asia or Africa or countries like that. And I don't know if it's vice versa, but in Europe, we're kind of like selfish, and we usually don't have much knowledge about the others, same like the States, I would say. But anyway, there is so much to learn about all the other continents. Sometimes we think it's not important because, like, you know, okay, we don't have, I don't know, we don't have malaria in Europe, but it's knocking on the door. You know, who cares about malaria? It's somewhere in other places in the world, but it's knocking on the door, and who knows what will happen. So we should know and learn from other countries that have some diseases compared to us, or other issues and problems. So already mentioned international associations are the ones that we talked about at the beginning. And there are some regional ones like our network in Europe, and also I'm sure other networks in other countries. And there are local associations. Now, this is something that you can get involved with no problem. So your local country, I'm sure, has something on One Health. Now, that's something you should get involved with. If you're interested in One Health, if you want to have your career in One Health, then you have to engage in your local associations. If you don't have one in your country, then you can probably associate with one with the neighboring country or something like that, so that you are totally involved in what's going on in your region. Now we come to One Hope, which you will hear about, I think, tomorrow from George. That is One Health for One Planet education. They're also worldwide, let's say, organization. They come from One Health Commission, I think, and they are involved in all of the education that's going on. You can find on their website. You will hear more about that tomorrow. That is also one great association for education in One Health. I'm just dropping my eye to the chat. So Friedrich Lofer established a new institute for animal health. That is so great. Okay, I just hope you will save this chat for me. It's valuable. There's so much good information in there. Thank you, people, for sharing this. This is so good. You can learn more from the chat than from my presentation. Okay, now journals and internet. That is something that you're already doing for anything that you have to do for your school or for your task or for your research. You have to go to journals and internet. So that is something that I think you have all already dealt with. And there are two journals, One Health, the official journal of the International Federation for Tropical Medicine, is very highly scored, and that is officially acknowledged International Journal for One Health. And then there is International Journal of One Health. It's just called like that. So these are the journals that have One Health in their name, but there is quite a bunch of journals with One Health topics. So there are journals for public health, journals for zoonotic diseases, journals for AMR. So for all the other issues that deal with One Health, all these journals are actually One Health journals. And then, yes, Dr. Jacques Ludeke is co-founder of One Hope. Yes, and he's presenting. Oh, Saturday. Sorry, I missed the date. Sorry. Okay, so read the chat for Dr. George. When you Google One Health, you get, I don't know how to calculate this, 6 billion 220 million answers. So you have to be very careful when you Google. You have to know what you're looking for. You have to put the right words in it. If you want to find something, it will not be easy. If you just put One Health, you will get a lot of bunch there. Okay, this is my favorite. You can tell that by the most pictures in it. Books. So the books on One Health are approachable, yes and no. You can't go to any bookstore or even to any textbook store and say, please give me books on One Health that you have. I'm not sure you will get it. So it's maybe better to find them online. I have put a few examples here that you can probably look for. The Integrated Approaches to Health has been published by the Network for Evaluation of What Health that I told you about. That was our post action. And we published it in 2018. And it's a book about approaches to health, but also about evaluation of One Health. I don't want to go into this because I'm sure Simon has talked about it on his presentation. So I don't want to repeat it. But anyway, it's interesting, but it's for people who already have some knowledge in One Health. It's not a basic book, for sure. Now, Introduction to One Health, an Interdisciplinary Approach is also a fine book, Approach to Planetary Health, sorry. It's also a very nice book published in 2019, and it's Introduction to One Health. So it should be basic and approachable. And then there are two more by George. I'm sure he will mention it on his presentation, Survival, and then the newest book, Circular Health, Empowering the One Health Revolution. That's the interesting one from 2020. I haven't read it. So I'm not sure if it's in online or you can buy it. I'm not sure. But it will be soon very approachable. So okay. Now that you have learned where you can get your knowledge, and let's assume that you already had that knowledge. What is it for? So what's the use of it? Why do we need it? Let's start with emerging diseases. So emerging diseases depend on several factors. If they're going to come or not, that depends on several factors, not only one. One of the factors is the adaptation of the microorganism and their ability to change. So what do you think? Put in chat just one word. Which research branch or which research can give you the answer to if the microorganism can or cannot adapt and how can it change? Which people work with that? So the veterinarians, the medical doctors, who works with the adaptation of microorganisms and their ability to change? Yes, you will get my email at the end. You have to stay until the end. You can't leave now. At the end, I will give you my email. Great, evolutionary biologist. Thank you very much. Don't put any more answers. Now tell me, who does research on susceptibility of the host to the infection? Which research branch does the investigation of susceptibility of the host to the infection? What do you think? If this host, if this animal or humans are susceptible to the infection? Nobody's brave? Okay, epidemiologists, immunologists, are great. Okay, perfect. Now, the emerging diseases also depend on climate. So some viruses or some bacteria will appear apart from COVID. So COVID is global, any season, any country, any. So don't think about COVID. But some other diseases, some like higher climates, some like colder climates. So which people are dealing with climate? All. Ha, great answer. Meteorologists, climatologists. Yes, great. So then we have, so this is very important, you know, you have to predict sometimes if the disease is going to come or not. And then you have so many factors that you count on. But if you're, let's say, a veterinarian, you want to research, you want to predict diarrhea. So I don't know how many of you are vets here. I'm a vet by background. So you want to work on diarrhea. Diarrhea is a worm that affects, let's say, dogs and humans and so on. And it can develop only in climates that are above 14 degrees, plus 14 degrees. That's when it can develop in the vector, and vector is a mosquito. So it very much depends in which climate you live in order to predict if you have diarrhea or not. So if you want to research it and look for it in a country that never has higher temperature than 14 degrees, it's totally useless. So you really need to address this question when you want to plan your research. Now, changes in the ecosystem. What does that mean? That means if you cut a forest and build a city, that is a total change in the ecosystem. So do you think that some diseases will appear? Do you think that something will change in that ecosystem if you cut the wood or it doesn't have to be a city, you can only put the crops. So you can cut the wood and put the crops. It's also total change in the of the ecosystem. So something will for sure happen there. Something will for sure change. The organisms will change. The animals that live there will change. That will make the changes in insects. Insects are vectors. That will change the pathogens they carry. That will change the appearance of the disease. So you see how much that is connected and how deep it goes. And so who deals with changes in the ecosystems? Environmental, wow. Okay, environmental anthropologists, ecologists, great. Okay, that is so great. And then you get the point. I know from your answers, you get the point. So, and then economic development and land exploitation. This is kind of connected with the previous one. But also if you exploit the land in a humane way. So you exploit, but you also enrich it in the same pace. That's okay. But if you only exploit until it's no worth anymore, and then you make a mess, and then it's again a problem, then it becomes economic problem. Okay, so who deals with that? Who deals with all the ruined lands, with ruined ecosystems? Also ecologists, yes, that is also true. And also people like geologists. And then we have the behavior and the demography of the inhabitants. Why is that important? You have countries, I don't know, okay, I will not search through your countries now, but I'm sure there are some people from countries that like to eat and drink thermically, how do you say that in English? Untreated cheese and milk, okay? So they just take the milk from the animal and drink it like that. Or they take milk and make cheese without any thermal treatment. So in countries of that, what do you think? Yes, unpasteurized. Yes, that's true. Okay. So raw milk, yes. So some people eat raw cheese and raw milk without pasteurization. And what happens? They get brucellosis, they get Q fever. So that's something that very much depends on the behavior of people. In some countries, that is even a tradition. They have, like in Malta, they have traditional cheese that is made from raw milk. It doesn't have any pasteurization process because it ruins the taste. I'm sure there are other countries with this example, but this is just the one that I know of. And so also in Serbia, we also have those kind of cheeses. And so that is very important. What do people have in their tradition? Oops, sorry. And then there is technology and industry, which also in Africa, okay. So, and then there is technology and industry that is also important, how fast a country develops. And then what happens to that country or region or whatever, a local, something locally, what happens when it drastically develops with industry? Everything changes. Now, One Health in public health. What can you do with within your country? There are countries, I'm talking about Europe, but I'm so sure that this applies to the whole world. So there are countries with absolutely no institution for One Health, no academic or no specialist education on One Health. Serbia is one of my country where I come from, Serbia, is also like that. So we don't have any courses in our faculties still. We have no institution that is called Institution for One Health in Serbia. But we have associations of One Health, and we have meetings and conferences that are so rich with One Health topics. And also we have experts in that field, but no guidance. What does that mean? That means that they have the knowledge, but they don't know how to apply it within the One Health approach because they were not taught that within their academic education. Now, there are initiatives in these countries with elements of personal collaboration. What does that mean? That means that I have very good friends of mine working at the medical faculty or medical institute, and we organize together projects, organize some kind of research, and that works. That works. We did that with vector-borne diseases. So now when COVID came, our government recognized that there is a very good collaboration between medical and veterinary science, and they have involved veterinary science within the COVID control. We have done, our veterinary institutes have done tests for COVID when it was the toughest time. And so we were, by the government, we were involved in the whole process. And that's a very good example. I know that there are countries that veterinary medicine was not involved at all. And there are also some other countries that even other branches were involved besides human and veterinary medicine. This also happened with West Nile and Q fever, that summer governmental intervention were done by both branches, medical and veterinary, and that came out very good. And even WHO was very pleased with what we have done here on governmental level. So guidance of these activities, that is very important. And that's what do people with One Health knowledge. Sean, am I over time?
No, don't worry about it. Just you can carry on. Yeah, don't worry about it.
Okay. No, just a few more slides and then the floor is yours. Now, there is one interesting thing that I wanted to share with you, and you will talk about that, I think, tomorrow with Deborah Thompson. You have her also as your speaker. There is education for non-grown-up humans, for kids. So there are One Health lessons for kids from 6 to 18 years, and that is so amazing. I had the honor to be present at one of Deborah's sessions with kids, and that is so interesting. And she works with them. You cannot imagine. I'm 50 years old, and I have heard of One Health when I was 40 years old, or I don't know, 35. And these kids are 8, 11 years old, and they talk about One Health. They talk about zoonotic diseases. They talk about species and stuff like that. It is so interesting. So I encourage you to listen to her. She's fascinating. Okay. Okay, so we have came here to the end, and I just wanted to remind you that we came from picture one. You see the picture one with the 3 circles: animal health, ecosystem, and human health. And actually, at the beginning, this ecosystem said only environment, and we came to this complicated declaration that has much more involved than only animal health, human health, and environment. So we have came a long way during these, I don't know how many years, let's say 10, 15, who knows, depends on the country. But we have came a long way with developing One Health, with promoting One Health. I'm so happy that there are so many enthusiastic people among you, and I hope that all of you become the One Health Army one day, and that you promote One Health in your own way. It doesn't matter which course of your career you take, if you stay true to One Health, and if you support it, then you will be able to have much richer career, if you understand what I'm saying, much richer in the meaning of new people, multi-scientific work, and you know, a lot of stuff mixed together makes a much better result than if you go just straightforward with your own career, like being a vet or med or whatever. Okay, I want to thank you for your time very much. I'm so looking forward to your chat. And oh, sorry. Okay. And I'm open for questions, if there are any. Sean, do you want to read it to me, or do you want me to go?
Maria will do the
Thank
question
you so
and answer.
much for your presentation, Dr. Sara Savić. I'll read the two questions we have from Michael. Hi, Dr. Sara. Thank you for sharing your insightful experience and for the presentation. When looking through the One Health lens, what's the role of diseases in population, and is eradication still the ultimate goal? Does the arms race not lead to a potential imbalance, or is the system already distorted?
Okay, I think I understood the question, but correct me if I'm going the wrong way. I don't know if the asker of the question is present, but correct me if I'm going the wrong way. So I think you're asking if we do it all together within the same topic, will we create a chaos? Is that the bottom line of your question?
Yes, it is.
Okay.
Okay.
Okay. Yes and no. If you don't have guidance, then yes. If you don't have guidance in the meaning of that you are all going the same way, if you start pushing against each other, if you want to say yes, COVID is from bats, and then the vets say no, COVID is not from bats, it came from a lab, and then the environment said, oh no, it didn't come from the environment, it came from something else. So if you go that way, it can create chaos. I agree. But that is why researchers are trying to make these working groups, projects, different kind of organizational institutions, or whatever you want to call it. That's why we're trying to create these consortiums that we can work within the one same way. And that is a very good question, and we have to be very careful when we do this. Like in our association in Serbia, Association for One Health, we're encouraging people to come and become members of the association, because it's so important to have vets and medics always come first, and then biologists come very shy, but they come after that. But we need geographers, we need climatologists, we need social studies are so important, anthropologists. So we encourage all of these people to come, because when you come all together and you sit around one table and you talk about one thing, you get a perfect solution, if you understand what I'm saying. Okay, does that answer your question?
Thank you so much for the answer. And after we have from Norbert Onyango, silos in One Health education has been cited in a number of studies as an impediment to success of the initiative. How is the challenges being dealt with in Serbia?
What is the beginning of the question? The first part of the question. What has been around the world?
I put the question in the chat just in case you can't hear it properly. So it says silos in One Health education.
Silos
this is
in
the
One
question.
Health education.
I think what our asker is trying to say is that I think traditionally in One Health views, there's a lot of separation in the different views, between medical doctors, veterinarians, environmentalists. There's a lot of compartmentalization despite the fact that One Health is about people coming together. And I think he's probably asking how, how is it going about in Serbia to bring the different professions together?
It's not going. Okay, so Serbia is not a good example because we don't have any kind of education that official education, that's what I mean, that collects people from different branches. We don't have that kind of, it's in the plan now, and we shall see how that goes, but we don't have that kind of going on now. So maybe we're not a good example for that, but as far as I know, all the other people have good experiences. I can't tell you from my personal one because we don't have it yet here. That's the end. That's the end of my answer.
Thank you. So I think we have another question from Roger Harrison, and he says, what are the differences in One Health, Eco Health, and Planetary Health?
Oh, that's a very nice question. Is there another part, or that's the question?
That's the question.
Okay, good. That is a very nice question. I kind of like skipped that because I thought that maybe some other speakers already talked about it. First thing that happened was One Health, because medical doctors and vets made a coalition and started working together, and that was called One Health. Then when the environmentalists and biologists started to approach in a more aggressive way, then they gathered that maybe One Health applies only to animals and humans, and they wanted to give the name Eco Health. So that is kind of like broader than diseases in animals and humans. That involves the ecosystem. And then there is the planetary health that involves the whole planet. So when you put it like that, One Health, Eco Health, planetary health, it seems like it's growing. But for me personally, that is all the same. For me personally, One Health and planetary health is the same, because when I say One Health, I also have in mind the ecosystem and the land and everything that goes with it. But maybe at the beginning, because the vets and medics have started One Health initiative, maybe, and at the beginning only vets and medics were in the One Health initiative, maybe that is why people from other branches needed to change the name into something bigger. Whatever you use, you're right. So there is no right or wrong. You can use whichever term you want.
Thank you for your answer. I think he just replied, he says, I think we need to call the agenda on antimicrobial resistance a planetary agenda, in response to what you just said.
Do I have it here? Oh,
can you
no.
see in the chat? It's just showed up on chat now by Roger Harrison.
Agenda on where did it go now? We need to call the agenda on antimicrobial resistance then a planetary. Okay, yeah, right. Okay, yeah.
Okay, we do have another question coming in. So before I ask Bumluck's question, just to go back to our first question from Michael, I think he's messaged me to try to clarify. I think he's too shy to ask you directly, but I think what might, I think Michael's tried to rephrase it. So he says, and I will put it on the chat as well so you can read it in case it's not coming through from my end. He says, looking at ecosystems and diseases from a One Health lens, is eradication still viable? So I think, because from his previous question, I think he's asking if we use a One Health approach, what is your expectations in terms of the way we deal with diseases? And I assume particularly infectious diseases and zoonotic diseases. And is it practical for us to aim for eradication, or are we looking more at perhaps management, prevention, and that sort of aspects?
Okay, I think I understood you now. So it very much depends on what we're dealing with. So like, if we're talking about brucellosis or rabies that we talked about before, and which are the, let's say, classic zoonotic diseases, then we can talk about eradication, yes. And many countries have eradicated those diseases based on the mutual work of veterinary and human medicine. But when we talk about situations like this we have now, when we talk about COVID, I don't know if maybe that's what you had in mind when you asked this question. When we talk about COVID, there is no eradication. There is only prevention and getting used to it. So there are diseases that you cannot eradicate. They will stick with us for a long time. But we have to either develop immunity or develop methods to overcome this situation now, or something like that. So if the eradication will succeed or not does not depend on that if you apply One Health approach or not. It depends on the pathogen. But if you apply One Health approach to the disease that is likely to be eradicated, then you will have much more effect if you apply One Health approach. Okay? I hope that was clear, because if you apply only one-side approach to a certain disease, you will never get rid of it, because you will still have it. You treat the humans, but you will still have it in the animals. So you will never get at the end, at the bottom line of it. And I guess there are still countries with, for sure, with brucellosis and rabies and so on. So you have to have in mind a lot of things, but if you can eradicate it, you will have much more success if you apply the One Health concept. Now you have reminded me to something else. I mean, this is my answer to your question, but you have also reminded me to something else. Not only zoonotic diseases are topic of One Health, and antimicrobial resistance. We can talk about a lot of other things. We can talk about obesity. Okay, so we can talk about obesity in humans and their pets. We have done some research on that side too. So that is also interesting how it affects both. We can also talk about, I don't know, let's say something that is totally out of line. Let's talk about depression. Okay, we can talk about depression in dogs and humans. That can also be One Health. We can talk about the increase of tumor diseases, of some malignancy in humans and animals over the years. So these are all One Health questions, not only zoonotic disease. We have to have that in mind also. Okay.
Thank you very much for your answer. Yep.
And the last question is from Bamlak Kashahun from Ethiopia. On your perceptions, what are the frontline challenges to One Health to be implemented globally?
Oh, okay. This is recorded. Is this recorded?
Yes, it is recorded.
Yes, it is.
Do you want
Okay,
this bit
then-
cut off?
No, I just can't say what I think. I'm just kidding.
You can give us your politically correct answer, and then when we end the recording, you can give
Okay.
the full lowdown.
No,
if
I
you want.
can't. Okay. First, it depends on politics, of course. Okay. It depends on money and politics, like everything else. But I think we're on a good path to implement it globally, because we know we're dealing with that problem. At the minute that we decided to deal with One Health, we know that we have to deal with enormous number of hurdles. How do you say those that you have to jump over? And that is why we have this attitude to do the networking. The only way the One Health it can be implemented globally is networking. So that is for sure. And once the One Health army is so big that the government has to listen to you, then you have the power to influence the governmental decisions and so on. And that is very important. And you get there by putting your good experts into visible places. So you in your country, you know who are good experts for, I don't know, epidemiology or public health or zoonotic diseases or AMR or whatever. And then when you have a problem in your country, you put them to be exposed, and then the government and the whole public starts listening to them. And that is how country by country we get to be visible and you promote One Health. And hopefully, let's see, how did you put, I love your phrase, then hopefully we will have One Health implemented globally. That is our goal. You know, globalization. I mean, look at Coca-Cola. So if Coca-Cola can do it, why cannot One Health do it? I know you agree.
Thank you very much.
Thank
Dr.
you,
Sara.
Roger. Thank you.
Oh, I think he's just had a follow-up question. He says, have you heard about the new Brucella strain, which is found in Ethiopia? From
Oh my God. Oh my God. No, I have. I don't want to hear about it. I'm so sorry. No, I haven't. If you have any information, I will be very interested to read if there is a paper or something. Please put it in the chat.
I think that's all the questions we have at the moment. If there are any more coming through, and please feel free to keep them coming, we will email them to Dr. Sara. So at this point, Dr. Sara, could I ask you to maybe just put your email that you'd like people to contact you by chat? Okay. I think everyone's very eager for that. So
okay. Before we finish, I want to ask you something. Just to put my email. You keep talking. You keep talking.
Right, well, you put your email in. Yeah, we just want to say thank you to everyone for joining us tonight, and obviously thank you to Dr. Sara. That was a really good presentation, and I hope you all have learned that, you know, there's countless of opportunities for you to be involved in One Health. And like I said yesterday already, I think a great point to start is just to do as many things as you can to join in on any opportunity and all these initiatives that are available. There's a lot of, today the chat has been buzzing and it's really good. I like to see that all of you are interacting with Dr. Sara. I think along the way we've posted a bunch of links as well, including links by the One Health Commission. So Dr. Cheryl Strout has joined us as well this evening. She's the Executive Director of the One Health Commission. She's put in some links that are also relevant to what Dr. Sara has been talking about tonight. So, you know, before you leave the meeting, maybe just quickly scroll through the chat. I know it's quite busy in there. See what's relevant to you and what you like to follow. But I'll let Dr. Sara have the floor again.
Thank you. Okay, please don't go away. I wanted to ask you one favor and tell you one international information. So the favor is that you don't leave and you put on your cameras and you turn on your cameras and we have a group picture somehow. If I may take it with my phone for all the screens, I would love that. So if Sean says that we can do that.
Yeah, that sounds perfect. So you should be able to switch your cameras on. You just cannot unmute yourself. So everyone should be happy to switch it on.
Perfect.
And while we're at it, I know you're probably wondering about the attendance for tonight. So once we do this picture, I will send the link for the attendance. So don't leave just yet.
Okay.
We will do this after we get the picture of Dr. Sara.
Okay.
I see it. Yeah, can you see it? I think everyone's switching on the camera now. So
except for Maria, she is ditching the class. And I wanted to tell you. With us. Okay, I wanted to tell you one more thing, and that is that you know that there are two calendars in this world. There is Gregorian and Julian, or something like that. And so by the Julian, that's the one that the Orthodox people use. So Serbia is mainly Orthodox country, and here it is New Year's Eve tonight. So by the other calendar, that is not the calendar that the whole wide world uses, by the other calendar, New Year's Eve is tonight. So this is my room. I think you can see the little lights in the back. I also have the Christmas tree still going on here. And so I just wanted to say Happy New Year if there are any more Orthodox people here or people that are celebrating New Year's Eve tonight. And for the others, I wish you a great and successful One Health, especially health year. Okay, stay there. I want to take a picture of you. Say cheese. Wait, I need to switch screens so that I can get all of you. Oh, this is so perfect. I love you guys.